So echocardiography is a fantastic tool for cardiologists. It's an affordable, transportable, miniaturized system that can be used at the bed of the patient. But the echocardiography today lacks of information about the myocardium and about what the myocardial properties. And this is exactly where we come here, and we proposed a new marker of myocardial properties, which is myocardial stiffness. So we think that this is a new information that can be implemented in ultrasound systems, and that will give additional information and crucial information about the myocardial properties.
I remember when we began to do these experiments and measuring stiffness in the myocardium, we were really happy with the first results. It was on volunteers, so young volunteers, old volunteers. And in fact, at the end, we found that the stiffness of their myocardium was increasing with age. Exactly as we say, we say we have the age of our arteries because our arteries are becoming stiffer when you become older. It's exactly the same with the myocardium. We have the age of our myocardium. I think I've got a myocardium 2 times stiffer than the one of Clément, unfortunately. But in fact, so even for normal people without any cardiac disease, in fact, your stiffness is increasing with age. And of course, when you've got a cardiac disease, it's progressing faster.
And moreover, what eMyosound will provide also is to be access to what we call the anisotropy of the stiffness. The stiffness is not the same in all the parts of the heart. You don't have the same stiffness in the anterior wall of the RV, in the interventricular septum, or in the left ventricular. And thanks to this new technology, we'll be able to describe this distribution of stiffness, and it's a true breakthrough for technology, but for the cardiology and for the cardiac patient. So we really need this. And as Mathieu say also, we now can access to myocardial properties and precisely myocardial stiffness. And this never been done, even by MRI, even by PYP. No one is able to give you this new parameter, and this parameter is key for the diagnosis of this disease and follow-up of this disease and prognosis of this disease. So it's a true breakthrough, and we have to work hard now on this with eMyosound to be able to give this to the population of patients and of the echocardiographies. So this is a new generation of echo coming.
It's a very important point because in fact when you image a myocardium, it's a lot of different layers with fibers. And in fact, the stiffness is not a simple value. In fact, there is stiffness along the fibers, transverse to the fibers. And in fact, the key technology we provide, in fact, is able to measure the stiffness changes and stiffness values along the fibers and transverse to the fibers. So it's really important because if you try to measure stiffness with conventional techniques, you miss this point. In fact, the stiffness along fibers can be 3 or 4 times stiffer than transverse to the fibers.
And because now we can evaluate stiffness, you can imagine that new drugs will come in the market to, for instance, soften your heart, Mickael. Because before we couldn't measure stiffness, today we can measure it, so the drugs can arrive.
And as we say, we're now able to access to these anisotropies, the distribution of the stiffness, and also to evaluate this in precise time during the cardiac cycle. And this is critical because everyone knows that the heart, there is contraction, relaxation, so the stiffness is, there is a variation of the stiffness during the cardiac cycle. We are able, with this new technology of eMyosound, able to evaluate the stiffness at one point in the time during the cardiac cycle. Now we are evaluating this at the P wave, just when you have the diastasis, when the myocardial stiffness is the lower, I think, so during the cardiac cycle, but we can do this in another time, and it's critical because when you do this at the same time, you are able to evaluate this. And now, as Clément said, new drugs come, they are already in the market for hypertrophic cardiomyopathy, for cardiac amyloidosis, and they are improving symptoms and prognosis. But all these new drugs and new companies working with these drugs and all the investigators, they lack tools to diagnose this population and to follow this population. It's very difficult. Up to now, you have to have a biopsy, invasive biopsy, MRI, special echo, and you don't know which type of tools you have to use for following this. We want to provide something, this new age, new generation of echo that will give you a precise characterization in space and time to evaluate this disease and to follow and to see if the medication are efficient, yes or not.